Hi, my name is Eileen. I'm a registered nurse, and I'm going to teach you how to do subcutaneous injections with one hand. So I'm just going to teach you some of the things about keeping sterile fields during the injection. So the top of the vial right here has to be sterile. You don't want to have any bacteria going in the vial, coming out, and then going in your patient. Also, the top of your needle canister has to be sterile, as well as the bottom of your needles, so here and here. So just keep that in mind when you're connecting different parts of the canisters and the needles during your injection. Okay, so the first thing you're going to do is pop the top off of your vial. So since this has the top is sterile. Now if it didn't, you would use an alcohol swab and just scrub it about 30 times, 30 quick scrubs. Okay, so but since it has the top on it, we can pop it off. Voila, sterile. Okay, so the next thing we're going to do is just rip this package open, hold down so it doesn't fly anywhere the canister. You can just leave it on the paper like that, that's fine. The next thing we're going to do, we're going to take a blunt needle. Now you could use your subcutaneous needle and draw the medicine out of the vial. I personally rather use a bigger gauge needle because then you're able to get the liquid out more quickly out of the vial, and this becomes really nice when you have very small ones that are like that big. So you're going to rip that open. Try not to touch the end. Okay. So then you attach the two ends. Okay. So we're going to get like 1 milliliter of fluid out of this, just playing around. Just loosen the top, you drop it down just like that. Okay, so you're going to get 1 milliliter of fluid. So you're going to drop it down to 1, get that air in. And then you're going to put the vial in the crook of your elbow, or you could hold it to the table, whatever works for you. So you could potentially go like this if that works. I just usually go in the crook of my elbow because my arm is a little bit longer. So instead of going straight in like that, where you have a chance of puncturing yourself, you really don't want to do that. You want to come in from the side, tap the end of your vial. You're still sterile because you haven't touched the needle, nothing like that. And then you straighten it, and then you go through. Okay, so then you're going to look like it upside down like that. Just make sure the needle gets below liquid level. Push your air through. And then we're going to get 1 cc of fluid. Now, since you may get some air, I just get a little bit more, so maybe like 1.2 on the measuring here, just so I can get out that extra air, because some of it's like 1 cc of air. Okay, you're going to pull your needle out. Just be slow when you do it. Voila. Okay, so then you're going to tap either on a table or with your hand, whatever you want to do, and just get out those bubbles and bring them to the top. So right now, there's no bubbles. They're all at the top. So then you get out your extra fluid. Okay. Now what I do is, because I'm using the blunt needle, I'm going to reattach to the top. Or you could screw off around here and detach it, but I like to have the top on, then I'm not as in danger of maybe puncturing myself. Okay, so you're going to use the scoop method. So you're going to bring your needle down, put it in the end, and then reattach, have that click, and then you can hold your canister from here, twist this off, and then you have your canister. So then I just leave it, the device in between my two fingers. Then I'm going to rip this one open, hold the top here, attach, still didn't touch the end. Okay, so there you go. So now you have your needle ready, and you're ready to give your medicine to your patient. In this case, it's a grapefruit. So we're going to use an alcohol swab. So just when you're doing this with your patient, you don't want to do the alcohol swab and then right then give the injection, because like the alcohol is going to go into your patient and then it's going to burn their skin and that's going to hurt them. You don't want this injection to be a miserable experience. It's already hard enough for them as it is because they get poked all day. So you're going to rip open your alcohol, work from your inside out in a nice circle. Just give it like, 3 seconds to dry. So when you do this and you're waiting for your time to dry, you're going to loosen up the top of your needle, let it drop. I don't like, coming from the top and pulling it off because I always feel like it's going to hurt one of my fingers. So I use this finger to make it loose and then let it go. And then you're not as in danger of maybe poking yourself. So just going to make sure there's no air bubbles. Get like one little drop to come out of the top of your needle. Okay. So since this is a subcutaneous injection, you're going to be delivering in the fat of your person. So the back of the arms is a good place, the stomach, your love handles. I typically don't like using the thigh unless I'm giving an injection of insulin with those pens in for patients. But, you're going to try to squeeze some of the fat. It's kind of hard to see because it's a fruit, but you want to try to squeeze some of the fat as best you can with maybe your little arm, and just roll it up as best you can. You come in at a 90-degree angle, like a dart. Deliver your medication. Come out. Flip up your safety so you don't get poked or poke your patient. And you're done. And you're done giving your injection. The end.
And cut.